So this would be like a practical approach towards like, okay, patient is in in the hospital. The patient actually has what a femoral hernia. All right. So how do you go about it? How do you go about the history taking, the specific questions you're going to ask them and everything? Okay. So let's cover it for femoral hernia right now. Before we continue, at least you guys should see what a femoral hernia is. Probably you know it, all right, but just to like see it again so that what the memories are much more fresher. So this is a femoral hernia right here, okay? This is a femoral hernia. Let's look at if you are taking a history for patient that you suspect have a femoral hernia. How do you go about it? Okay, so when taking a history from a patient with a hernia, the following elements are included. All right, you look out for chief complaints. All right, what actually brought the patient to the hospital? All right, so the chief complaint is you ask the patient to describe their main symptom or reason for seeking medical attention. All right, they should describe the main thing that actually brought them to the hospital. All right, then history of presenting illness. All right, ask the patient to prescribe the event leading up to their symptoms. Do you understand? Do you understand? These are the specific questions you ask them. When was the hernia first noticed? All right. You see some patient telling you that, bro, this is like 6 years ago. All right. But I was back home taking herbal medicine. All right. That's me talking about Africa right now. You understand? All right. Then ask them for any precipitating factors like were they doing some things that will make the hernia come out? All right. Like were they lifting weight or were they straining? Do you understand? Then any associated symptoms, ask them like, what do you feel? All right. Do you feel pain? Do you feel discomfort? Do you feel bloating and all the stuff? All right. Then past medical history, so much important. All right. Ask about any previous medical conditions, like have they ever had any surgeries? Have they ever had any injuries? Have they ever had any car accidents? Very important, right? Because trauma to that area might have caused that area to become weak over time, right? Then family history. Ask about any family history, hernias, or abdominal wall defect. All right. Do your father have mostly the first degree relatives? Father, the mother, uncles, siblings. Do you understand? Does anybody has hernias, right? So you try to see if it's family linked. All right. Then social history. Ask about the patient occupation. Is your work actually just uh energy demanding work and all the stuff, right? All right. Ask about their physical activities and any other factors that may be contributing to what hernia, right? So this image just illustrating history taking is just you holding a book, trying to what get valuable information from the patient that you use that information to treat the patient. So patients actually have what the cure to their illnesses, all right? But you as a medical professional now, you have to what be tactical about what trying to get that information from these guys. All right, then the symptoms. Ask about the severity and duration of symptoms. How long does it last? All right. Ask the patient on a scale of 1 to 10, where does your pain actually fall at? All right. Then ask about any associated symptoms such as what pain, numbness, or weakness. All right. Numbness and weakness, of course, should be related to is the hernia, is there some what nerve injuries or stuff like that. All right. Then ask about any changes in bowel or bladder habits. Then previous hernia repairs. Ask the patient if they have had any previous hernias, right? And if they have had hernias, all right, and they actually opted in for repair, how was the repair like? Okay, how did it go? All right. Then current medications. Ask about any medications that the patient is currently taking, including anticoagulants or medications that may affect wound healing. Allergies. Ask about any allergies that the patient has, especially to any materials in used in surgical mesh. Do you understand? So that you don't come and use surgical mesh, then later on they are reacting to it. All right. Review of systems. Ask about any symptoms or conditions that the patient is experiencing now, such as what? Abdominal pain, nausea, and vomiting. All right. So just a summary. The history asks their age. All right. And you know that what hernias are uncommon in children and more common in old age females. All right. Sex. Hernias are more in women than what men. All right. The patient came with what local symptoms, so you should note out for them like discomfort, pain, swelling in the groin. Okay. General femoral hernia is more likely to be strangulated than one inguinal hernia. All right. Multiplicity. Femoral hernia is mostly occur like bilateral. Okay, on both sides. All right. So that's it about history taken for patients with femoral hernia. Okay, that's it.